Hi, my name is Guy Hewlett. I am the Medical Director of Labor and Delivery at Cooper University Hospital, and I am also the Vice Chief of Quality and Safety for the Obstetrics and Gynecology Department at Cooper. I am also an Assistant Dean in the Office of Diversity and Community Affairs at the Cooper Medical School of Rowan University. And I got the COVID vaccine because I think that this is the best way to end the pandemic. The facts are that at this point, currently today, over 470,000 Americans alone have died from this virus. African Americans and Latinx people are disproportionately represented among those groups. If we get the virus, we're much more likely to get seriously ill, we're much more likely to die. In the meantime, they've vaccinated over 30 million Americans to this point, and there have been no deaths from the vaccine. Now, you might have heard reports about allergic reactions, and allergic reactions happen to virtually any drug. You can get an allergic reaction to Tylenol or Motrin or aspirin, any common drug that you take, and the vaccine is no exception. It turns out the risk of having a serious allergic reaction to the vaccine is about 1 in 250. You're actually more likely to be struck by lightning than to have a serious allergic reaction to this vaccine. Of the people who had the serious allergic reactions to the vaccine, none of them have died from the allergic reactions. There's a period of observation after you get the vaccine that's built into the process when the serious allergic reactions are detected. Even the ones that occurred outside of that window that tended not to be as acute as the anaphylactic reactions, those were detected, the patients sought medical care, and they were appropriately treated as they would have been for any other allergic reaction, and they're fine. I have many patients who've come to me for advice about this, and I advise them that this is a safe thing to do. We have a much better chance of ending the pandemic if we can achieve herd immunity. By that I mean vaccinating at least 75% or so of the population, and that would enable you to do what I'm doing right now. So I'm in a room with 2 people, all 3 of us have been vaccinated, and because we feel safe, we feel confident in the effectiveness of this vaccine, I'm able to speak to you without wearing a mask. Once I leave this room, I put my mask back on, and I go out and face the rest of the world. Again, I really implore you, if you have questions, please reach out to us. Cooper has many resources to answer questions. I'm happy to answer any emails, phone questions. This is something I do almost 24/7. Responded to questions about the COVID vaccine. Pregnant women also, there's a separate special class, but I can counsel patients who might be pregnant about what you do with regard to the COVID vaccine. There's a process that I'd be recommending you go through. So thank you very much.